that should be arriving very shortly for the last exam of the day. And perfect timing. Hello there, welcome to Dream City Clinic. I am Nurse Luna, and you have arrived just on time. May I first grab your name? Perfect, and if I do believe so myself, you are here for the every single doctor nurse exam possible for Dream City Clinic. Yes, and this includes doctor, nurse, dentist, cranial nerve exam, a chiropractor, etc., examinations for today. Perfect, and would you like this exam to be quite fast, or would you like this to be very, very slow? The fast one, okay, do you have a lot of things to do today or for the rest of the night? Marvellous, let's just write you down here, and just before I'm allowed to check you in very carefully, could you give me your birthday? Beautiful, and could you let me know if your address is the same as last time, or has it changed? Marvellous, and how has your day been? Perfect, I will have myself, the nurse, start first. Just relax yourself, take a seat, and we will see you very shortly for your first nurse exam. Cheers, love. Okay, and I've got my gloves on. First, we're just going to get your vitals. I'm going to use my stethoscope here and listen to your heart rate, okay? So, how's your heart been? Have you been doing good? Marvellous, darling. I'm going to place this right on the sides of your chest. So, I want you just to breathe in, breathe out. Just going to get your heart rate good. Marvellous, no time to waste. Other side. Marvellous, perfect. Looks like your heart is doing quite well. Next, I'm just going to gauge the blood pressure. I'm going to put this on your arm. I'm going to ask you to sit still. Good, and how have you been? Very good. I'm going to just add a bit of air into this. You feeling okay? Good. And that looks amazing. Perfect. Going to release that. I'm going to take that from the arm. Good. Next, I'm going to check right inside of your ears. Do you have any problems with allergies or any problems with your ears in the past 2 weeks? Okay. I'm going to ask you, can you hear this? Could you hear that? Good. Other side. And can you hear that? Marvellous. And one quick check. I'm going to look for just a little bit. Can you look into my eyes? Can you look down? Can you look up? Good. And can you move your hands? Good. And can you shake around your legs? Perfect. It looks like your body's doing quite well. I'm going to have the doctor check you next for the quick cranial nerve exam. Is that okay with you? Amazing. Thank you so much for coming on by to the very fast nurse exam. On to the doctor. Cheers, love. And hello there, I'm Dr. Brain. Today we're going to be giving you a very fast cranial nerve exam to make sure that your cranial nerves are working. If you've ever had one before, what I'm going to do is I'm going to test the way that your nerves work in conjunction with your eyes and your facial features. Good. So I'm going to ask you, close one eye, and can you read the first letter? What is it? It is E. Marvelous. Going to cover the other eye. Can you read the second line? What do the letters say on the second line? That is L and T. Amazing. Looks like your brain is doing well. I'm going to give you a very quick color test. I'm going to show you this object here on this card. What color is this? This is yellow. Amazing. I'm going to show you this object. What color is this object on the card? It is orange. Amazing. And moving on to the last one. What color are these? These are pink. Looks like your brain is working well. I'm going to quickly test your sense of smell. This is called your olfactory nerve sense. So I'm going to put an essential oil next to your nose, and you tell me as fast as you can what you smell. Ready? Let's begin. What does this smell like to you? Amazing. This smells a bit like a citrus, like a fruit. What would you guess? It is orange. Good job. On to the next one. So we do have one here that is a bit more earthy, is what I would like to say. I do adore the smell of this one. What do you think this one is? A bit like a spa, a bit luxurious, like a flower. What would you guess? Lavender. It is lavender. And on to the last one. We have this last one here. It's a bit more earthy as well. And I do love the smell of this one. And what does this one smell like to you? Yes, a bit like gum. Amazing. And what would you guess? A mint. Amazing. This one is eucalyptus. Looks like your cranial nerves are working amazing. Next, I'm just going to send you to the eye doctor to check your eyes. Let's see if you can see well. Cheers, darling. On to the next doctor. Oh, and hello there. It's great to see you. I am Dr. Optic. Today I'm going to be checking your eyes, okay? First things first, I'm going to ask you just to do a quick follow the light exam for me. Follow this pen light as best as you can, but don't move your head. Good. Let's begin. Amazing. Do you wear any contacts or glasses? Okay, and have you had any problems with your eyes? Okay, let me know, is the light closer or farther away from you now? Closer or farther away? Good, and closer and farther away. Closer and farther away now, and closer and farther away now. Okay, and is this light quite far away from you? Can you still see it? And follow the light over here. Good, and can you still see the light? And follow the light from over here. Amazing, perfect. So what I'm going to do now is I'm going to ask you just to sit still. I'm going to just carefully measure your eye measurements. Just sit still. I'm going to just get right there. It looks like your eyes happen to be about 4.5 away from the center of the pupils, which is perfect for the dilation. So I'm going to ask you just to sit there just for a couple of seconds. I'm going to magnify and take a look into your eyes. You can see I can see you quite well with these. I'm going to ask you, can you see the light on this? Can you look at the red light there? Good, look at the red light there. And look over here and look at the red light over here. And look at the red light over here. Is the light on your left or your right side? Good. Now is the light on the left or your right side? Very good. And what shape is the light drawing in your face? Is the light drawing a certain type of shape? What shape is that? That's a circle. Good. What shape is the light drawing now? That is a triangle. Very good. And what shape is the light drawing now? Follow the light. That is drawing a square. Amazing. Looks like your eyes are doing quite well. And final quick test. I'm going to test your visual sense with light colors. What color is this lamp right there? It is red. Amazing. What color is it now? It is a purple. Great. What color is it now? It is blue. Amazing. Looks like your eyes are doing super. I'm going to send you on to the next doctor now to get your ears checked out. Are you ready to hear something brand new? Well, I'll have the doctor come and see you now. Cheers. And hello there. Pleasure to hear you in the office. I'm Dr. Ear. Today we're going to be examining your ears, and first I'm going to take a look. Then we're going to give you a sound test. Sound good? Amazing. Do you wear any hearing aids or anything like that? Marvelous. So I'm going to first ask you to relax. I'm going to take a photo right here. Can you hear this? Good. On the other side, relax. Let's see. Marvelous. And let me know. I'm going to put my hands right next to your ears. Can you hear this? Good. Marvelous. Good. Now I'm going to give you a sound test. You let me know if you hear the beep coming from your left or your right side. I have these two sound boards here. I'm going to make sounds. Raise your hand if you hear from your left or your right side. Let's begin. So. Okay, good. 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 Marvelous. Okay, and just a quick look inside your ears one more time. Just going to take another quick look. And on the other side. Perfect. And now I'm going to ask you. I'm going to tilt your head. You let me know if you feel any sense of imbalance, because your ears are directly related to your balance. Do you feel okay? Good. And to the other side. And do you feel okay? Marvelous. Tilting it right back to the center. I'm going to just put my hands right there. Can you hear that? Good. And do you hear everything well now? Amazing. So I'm going to have someone else see you next. Thank you so much for letting me hear and test your ears. On to the next Dr. Delta. Bye. And howdy there. I'm the chiropractor. I'm Dr. Bag. Today we're just going to be cracking and checking your bones and your back. Does that sound good with you? Good. And I have a couple of questions you before we begin. Do you feel like you have a lot of back pain and a lot of back pressure? Okay. And do you sleep on your side or on your back? I knew it. So what I'm going to do is I'm just going to carefully manipulate your bones. Does that sound good? Good. It's going to feel real relaxing. Okay. So I'm going to put my hands right there on your shoulder first. Okay. And 3, 2, 1. Good. Does that feel good? Amazing. Now right there on the side of the shoulder. 3, 2, 1. Good. Does that feel nice? Amazing. On to the other side. 3, 2, 1. Good. Does that feel good? Okay. Now shake your shoulders out. Very good. Now I'm just going to put a little bit of pressure, just a little bit of pressure right there on the side of the chin. Okay. 3, 2, 1. Good. Does that feel nice? Amazing. On the other side of the chin. 3, 2, 1. Good. Does that feel relaxing? Really good. Now what I want you to do is shake your shoulders out. Good. And what I'm going to do is I'm just going to put my hands right there on the side of the jawline. We're just going to relax in 3, 2, 1. Good. And one more time. 3, 2, 1. Okay. Now what I'm going to do is I'm going to carefully just massage the scalp a little bit. Okay, and on the shoulders. Okay, and perfect. Now move around and now tell me how you feel. You feel kind of relaxed, don't you? Marvelous. Well, thank you so much for coming on to the chiropractors. We're going to send you on next to the school nurse, I'm pretty sure. Yeah, well, cheers then, and I hope you have a relaxing sense of the rest of your day. Cheers, darling. And perfect timing. Hello there, I'm School Nurse Moon. Today we're just going to be checking your temperature and checking for lice, okay? I want you just to sit still. Looks like your temperature's doing well. Have you been feeling well the past week? Good, just making sure that your health is great. Now what I'm going to do is I'm just going to take a look at your scalp with a little tool here and my little comb because we're going to be looking for lice, okay? May I check your scalp? Good, I'm just going to just check around your hair, okay? I'm just going to just brush. I'm going to be looking for a little bit of lice there, okay? And just a little brush. And looking for lice. I'm gonna take a look over here. Okay? I'm gonna take a look. Just going to brush. And just checking for the lice there. Okay, nothing seems to be over there. And I get a little bit of a brush there. You have beautiful hair. Is this your natural hair color? It's gorgeous. And looking right at you, it does look like your skin is also quite healthy, which is very good. So just gonna rush through this really carefully, okay? Gonna just get a little bit of the comb on this side. We're gonna just brush. Gonna take a look. Gonna take a look. Okay, and look at me. Marvelous. It doesn't look like there's any lice in there at all. I'm just gonna just sanitize really quickly just by spraying a little bit. Gonna just massage that in. And it looks like another special will be seeing you right after this, okay? Good, just relax yourself and have a good rest of your time here at the clinic. Cheers, darling. And hello there, I am Dr. Tooth. I am your dentist today. We're gonna be taking a good look at your teeth. Have you been brushing and flossing every single day? Well, I will be seeing that every single detail. So, first, I'm going to get a light and a toothbrush first, okay? I'm going to ask you to say, oh, marvelous. Let's see the teeth. Good. Okay, looks like your teeth are actually quite beautiful. And have you had your wisdom teeth removed? Perfect, okay. I'm going to take a quick look with some of my tools to say, oh, good. And I'm going to quickly show you what I do see, okay? So, sometimes when we do have teeth, we have cavities. What we like to do is we're going to just carefully just remove a little bit of the cavity very quickly, okay? I'm just going to get my tool. I'm going to get my tools there. We're going to take a quick look at the cavity. Let's see if we can remove that, okay? Can you just say, oh, a little bit of a solution there. Good. And it looks like everything should be A-okay and marvelous now. Now just smile for me. Perfect. Looks like your teeth are gorgeous, just like you. I'm going to send you on to the scientist next to have a little bit of research done, but keep your smile shining bright because you deserve to smile. Thank you so much for coming to the dentists. On to the next one. And hello there, I'm the research doctor. What I'm going to do is I'm going to just research and get a couple of samples of you to send them to the laboratory so we make sure that you are doing A-okay with all of your biology and microbiology. Does that sound good with you? Perfect. So what I'm going to do is I'm going to ask you first just to relax and look up. Could you look up for me? Good, I'm just going to take a quick sample right there from under the eye. On the side too. And can you look at me? Good, can you look down? And can you look back up? Marvelous, looks like that's doing fabulous. Now we're going to take just a very waist. Here we go. Good. And now I'm going to test your reaction to a little bit of air. I do have a button here and it's going to blow a little bit of air into your eye, and I'm going to see if you have a reaction, okay? So we're just going to test your reflexes. 3, 2, 1. Good. And 3, 2, 1. Good. Now I'm just going to carefully test your reflexes. I want you to let me know. Does this feel like my hand is close to your eyes when I do this? Good reflex in here. Good reflex. Now I'm going to test just a little bit of your reflexes. Can you raise your eyebrows very tall? No time to waste here. Very good. Can you close your eyes very tight? Good. Let's just see. Perfect. And can you raise your shoulders as if you were making a motion? Good. I'm going to actually ask you, can you keep your shoulders raised? I'm going to push down on them. Good, 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 good. No time to waste. Marvelous. Looks like all of your reflexes work well. We do have samples. We're going to send them in. We're going to report them back to you, okay? Thank you so much for allowing us to just give you a couple of examinations today. All of our information is collected from every single fast medical exam that you've had. I hope you have a speedy sleep and have a good rest of your night. We hope we also did speed right through every single exam to have you have the best fast sleep of your life.